I'm here today kwa sababu ya kufanya universal health coverage spot check to check that the programs that we are putting in place zimefika mashinani. His Excellency the President launched the kits. He also launched the CHP program officially on 20th of Mashujadi. So today I came to see, did Nyandarua do the same? And we have the CHPs in Nyandarua. And I have confirmed that they are here. And we have today we have also delivered the gadgets that we had promised that each CHP will have a gadget. And for Kenyans to know that these gadgets are locally assembled, made in Kenya, for Kenyans. So that is what we have also delivered today. Before the rains began, we had a multi-agency, multi-ministerial committee that was chaired by His Excellency the Deputy President, and each ministry gave its plan on what it is doing to ensure that it's able to take care of such scenarios. As a Ministry of Health, we have ramped up our supplies for waterborne diseases. You know, we are likely to have cholera, we are likely to have some dysentery and all that. We have ramped up our supplies. But equally this month, actually we are supposed to do it tomorrow, but we have carried it forward. We are going to launch our mass mosquito net distribution, long-lasting treated mosquito nets. We are launching in the next 1 week, so that we ensure that all families then that need mosquito nets are covered even during this rainy seasons. Yeah. We are doing it across the country. Thank you. Yeah. But while here as well, we have had discussions with the governor. I have walked around the facility, the JM Kariuki Hospital. We have been to the new project. It is making good progress. It's a 500-bed facility, and there are promises that were made by the national government. So I have promised to go back and speak to His Excellency the President to see how is it that then we support Nyandarua County to complete that project that will take care of the residents of Nyandarua. Equally, I have been to many places within the hospital. I have visited the CT scan, which is under the medical equipment program. I have visited the dialysis, also under the MES program. We have a few challenges here and there, some that I'm going to handle straight away. For example, the dialysis machine, out of the 7, I think 6 are working. 1 that is not working, that is going to be handled.
Hi.